Globally and even locally, there's a gap between the policymakers and researchers. And this gap, for us to make evidence-based policies, there's need of reducing this gap. So as the Malawi government, we realized that we have got that gap between the researchers and the policymakers. So what we did, we introduced what we call the knowledge translation platform. This knowledge translation platform, it's within the Government of Malawi initiative, and it's housed in the Ministry of Health in the research unit. So what we do, we produce policy brief which inform policymakers on what research evidence is there. And even when the researchers want to conduct research, we make sure that research which is being produced by the researchers, it's what the policymakers need. Because if you've got that gap between researchers and policymakers, there will be no proper communication. So the knowledge translation platform, it's one of the methods which is used to reduce that gap, hence promoting the use of research evidence in Malawi. There's some examples where there's importance of using research evidence in decision making. The most common example is in terms of HIV prevention. After looking at what the research findings found in terms of importance of having circumcision, the Malawi government, through the Ministry of Health, introduced in their policy of HIV treatment, prevention and care, they introduced a voluntary male medical circumcision. This is backed by evidence which was done even in Africa, and it has shown that it reduces the prone of how a person can contract the HIV. Though it looks like it's a good initiative to make sure that policymakers and even researchers, they are talking to each other, there are some other factors and challenges which the knowledge translation platform faces. So from most countries, there's a problem with political influence in terms of how to use evidence. But as a knowledge translation platform, we have already tried to address some of those challenges like political influence. So the first thing is the knowledge translation platform is housed within the Ministry of Health, which also gets support from the government. So because it's one of the initiatives within the government, though they have got, it has got a lot of stakeholders from different institutions, it's a mechanism which doesn't really depend on who is the one leading the ministry, like maybe the minister or which party is in power, because it's part of the government. That's the first mechanism. The second mechanism, it's we've got another partner who is also working with Parliament. So because of that, they work with clerks of Parliament who give an introduction or maybe an induction course to newly elected parliamentarians. That helps the parliamentarians to have a mindset and even to champion the importance of using research evidence. Through attending this kind of meeting, like the one which the African Evidence Network organized by UJBQ, it's a way of trying to build capacity for even the knowledge translation platform for Malawi. These kind of forums, they help to open up, to have links with regional and even international partners, and even you can expose yourself and you gain some knowledge in terms of monitoring and evaluation, how to monitor the progress. Because if you're just going to be conducting program, maybe running programs without monitoring them, without evaluating them, you end up not knowing what you are doing good, what is bad, what is improving. So by involving this kind of networks, it will be good because there's also a newsletter which is circulated, and we keep each other updated. We help each other to solve challenges and even in terms of improvement on our program.